Hi, I'm Jack Fuqua, one of the program directors for the fellowship here at Indiana University.
And I'm Erica Oikster, co-director of our fellowship program.
We're really happy that you have applied to our program and are interviewing with us, and we look forward to getting to know you. For right now, we'd like to share a little bit of information about our program with this brief slideshow. So Riley Hospital for Children has been around for almost 100 years. It was named for the poet James Whitcomb Riley, who in his day was much celebrated and much beloved as a children's poet. In 1924, the hospital was established in his name, but it wasn't until 1969 when we had Pediatric Endocrinology here. Over the last 30 years, the faculty has grown tremendously. In 1991, when the fellowship program was established, there were 3 faculty. We're happy to say we've grown to 17 as of this summer. The first fellow completed training in 1991, and in the interim since then, 34 fellows have graduated. We're really proud of our MedPeds fellowship program. We've had 6 graduates of that program and 1 new fellow starting that program this year. Of the 34 fellows that have finished the program, 70% have academic positions, 15% are in private practice, and 12% are in industry. We currently have 4 fellows. Sarah Aka, who's our first year MedPeds fellow, Lauren Logan, our first year pediatric endocrine fellow, Rita Seraphim, who's our second year fellow, and Nora Amutlak, our third year fellow. And you'll get a chance to meet them during your interview. Raleigh Hospital for Children is the largest children's hospital in the state of Indiana. About 350 beds, close to 10,000 admissions per year. The outpatient center is very busy, 273,000 outpatient visits over the last year, and almost 40,000 emergency department visits. We have the only pediatric burn unit in the state of Indiana. And depending on how you measure it, we have one of, if not the highest acuity level in the country in children's hospitals. Our faculty has grown to 17. The main site is Raleigh Children's Hospital. We are pretty busy. We have about 230 admissions per year, a little over 300 consults per year. In the outpatient center, in the endocrine clinic, we have almost 13,000 visits per year. Depending on how you measure it, we have close to 2,000 children and adolescents with diabetes, and we get about 25 new outpatient referrals per day. Additionally, within the downtown medical campus, we have 2 other hospitals that we cover. Methodist Hospital and Eskenazi Hospital both have NICUs, level 3 NICUs, that we do some consultations at. But the vast majority of our clinical volume is seen at the main Raleigh Hospital. This is some of our clinical volumes. This is in the last couple years. We have about 9,000 patients in the endocrine clinic that we see. By this measure, we have about 2,000 diabetics. The vast majority of our diabetics are type 1. We have a rapidly growing population of type 2 diabetics. About half of our diabetics are on insulin pumps. On the graph on the left, you can see our breakdown of our endocrine patients. The majority of our patients have either thyroid disease, puberty disorders or growth disorders, and then a number of other conditions. We have about 300 transgender patients, another 300 or so pituitary patients, and then other patients, including categories like CAH or other DSDs, Turner syndrome, metabolic bone disease, and other things. This is a map of the medical center, and this in the middle part of the map is Raleigh Hospital. The outpatient center is a four-story building. The main inpatient unit is a 9-story building, and just adjacent to that, and connected by an overhead walkway, is the Well Center for Pediatric Research, where many of the basic science research labs were located. Across the street from the Well Center is the IU School of Medicine main building. There's additional research labs. Many of our diabetes labs are located there. Next to the IU Medical School is the University Hospital, the main adult academic medical center. We currently don't see patients over there. There's no pediatric units there. Across the green space from the Raleigh Hospital is Eskenazi Hospital. This is the main county safety net hospital. where there is a NICU located. And then for any med-peds applicants that are out there, the VA Medical Center is located on the other side of Eskenazi, and VA med-peds endo fellows will do some time in the VA. Methodist Hospital is located about a mile northeast of the main medical campus, accessible by a shuttle system. We have other clinical sites too in Indianapolis. We have a clinic on the north side of town. We have another clinic on the south side of town. And then as far as outreach clinics, we have patients in South Bend in the far north of the state, Bloomington about 60 miles south of Indy, Evansville in the far southwest of the state, and Fort Wayne in the far northeast side of the state. So we go all over, although our fellows generally don't spend a lot of time at these other campuses. There is a little bit of clinical time spent at the IU North Center during the program, but otherwise fellows generally don't do a lot of traveling.
So as far as how the fellowship is structured, during the first year, there are 7 inpatient months, 1 outpatient month, and 4 months of research. Year 2 is comprised of 2 inpatient months and 10 months of research. And year 3 is 1 inpatient month, 1 outpatient month, and 10 months of research. And when fellows are on service, they do see urgent patients as needed. For example, babies with congenital hypothyroidism or CAH or ambiguous genitalia. Next slide. The inpatient consult team consists of the fellow, the attending, 1 to 2 pediatric residents, and typically a 3rd-year medical student, occasionally also a 4th-year medical student. And then we work with a diabetes educator and a social worker. And currently we are a consult service only on the inpatient side. Next slide. Call is taken from home 1 night per week throughout the entirety of the 3 years. And fellows also take call 8 weekends a year. So our call schedule does not change regardless of whether you are on a clinical month or a research month. And as I'm sure you all will not be surprised to hear, the volume is extremely variable. Some nights are very quiet and other nights are, incredibly busy, but you are always at home during these call nights. Next slide. Weekly continuity clinics consist of 2, we call them fellow clinics a month. These take place on a Friday afternoon. And during these clinics, all of the fellows are together seeing their own panel of patients. The fellows each have 1 solo endocrine continuity clinic per month. And 2 of these during the year are designated as gender health clinics so that all of our fellows get experience in taking care of transgender patients. Fellows also have 1 solo diabetes continuity clinic per month, and then the attendings rotate in terms of staffing. So you will work with 1 particular attending in your solo clinics for about 6 months, and then you'll have the opportunity to be staffed by someone different, and this will continue throughout the 3 years. So fellows get exposed to a wide variety of practice styles. Next slide. We also have quite a list of subspecialty type clinics, and fellows rotate through these different clinics. If fellows have a particular interest in one of these areas, they have the option to spend even more time in one of these special clinics. But these consist of the metabolic bone disease clinic, we have a type 2 diabetes clinic, a cancer survivor clinic, a gender health clinic. Youth diabetes prevention clinic is for children with pre-diabetes and obesity. We also have a CAH clinic and a Prader-Willi clinic. Next slide. And we also have a very active and popular diabetes camp, which is called Camp John Warville. This is located in northern Indiana, and it lasts for 1 week each summer. we do expect all of our fellows to attend diabetes camp at least once during their training, or to at least attend 1 week of camp, which could be broken up. So you might want to go just for a couple of days for 3 years in a row, and that's also fine. Next slide. There are a multitude of conferences that take place on a weekly or bi-weekly basis. After each of those group fellow continuity clinics, we have a clinical conference. We also have a division meeting that occurs weekly on Tuesday mornings at 10 o'clock. And this is an opportunity for the ward team to present cases. That happens once a month. We also have a pediatric endocrine journal club that the fellows present during this division meeting. We occasionally have outside speakers. We do have one endowed lectureship in pediatric endocrinology that occurs annually. And then this is an opportunity for drug reps to come and share new products with us. And then we also designate some of these for quality improvement and administrative issues. Next slide. So in addition to the fellow case conferences, which is where each of you discuss the patients that you saw the previous week in your continuity clinic, we also have a series of didactic lectures that the faculty sign up to give that occurs all throughout the year. And this is also kind of considered a board review type of activity. Once a week, we have a combined endocrine grand rounds with the adult side, and we are responsible for scheduling a subset of those lectures. So some of them are very relevant to pediatrics. There's also pediatric grand rounds once a week. There is a Center for Diabetes and Metabolic Disease Research Conference that occurs once a week. And then there's Bone Conference once a week that also occasionally features a pediatric patient and pediatric topics. Next slide. And there are a multitude of opportunities for research for our fellows. There are many mentors both within and outside of the division, and the options in terms of what type of research really are limitless. So fellows can certainly pursue clinical research as well as translational and basic science projects. There are particular areas of expertise within the division in diabetes, both type 1 and type 2, insulin resistance, obesity, bone disease, and then general endocrine topics such as growth, puberty, thyroid, gender dysphoria, disorders of sex development, etc. Next slide. We also have within the Department of Pediatrics is the Morris Green Research Program, which is a competitive program that our fellows have the option to apply to. It is a wonderful program that provides additional research mentorship, monthly seminars, an annual retreat, meetings with visiting scientists, as well as pilot research funding. So fellows that are considering more of a research trajectory are highly encouraged to apply to this program, and many of our fellows have participated and found it to be incredibly valuable. There are also a number of intramural funding opportunities through the Department of Pediatrics, and I believe there are 2 cycles per year where fellows can apply for up to about $10,000 to support their own research projects. Next slide. Our fellows are extremely productive in terms of research, and the average number of abstracts and or posters or oral presentations is about 5.5 by the end of the fellowship training. And then our fellows also publish on average almost 7 peer-reviewed papers or chapters or review articles throughout their 3 years. So there are many, many opportunities that come your way in terms of academic productivity. And this looks fabulous on your CV when you're going out there and starting to apply for positions. Next slide. As Dr. Fuqua mentioned, I think on an earlier slide, about 70% of our graduating fellows are in academic medicine, and about 15% have entered private practice, most of whom also still have a component of trainee education. And then 12% of our fellows are working in industry. Next slide. Indianapolis, in case you didn't know, is the 13th largest US city, and we are a relatively diverse city. We have one of the largest Burmese populations in the US. 65% of the US population lives within 1 day's drive of Indianapolis, which is why I think our motto is the crossroads of America. Indy is second only to Washington, D.C. in its number of monuments and memorials. And we were ranked number 3 by Money Magazine for most affordable cities to buy a home. That is very true. The cost of living here is extraordinarily low. And the suburb of Carmel was actually ranked number 1 as best places to live. We also are home to the world's largest children's museum. Next slide. And the Indianapolis Museum of Art is also a world-class institution, and it also has an expansive outdoor gardens and has works that were featured in the movie The Fault is in Our Stars, also a book some of you may have read. We have one of the nation's largest city parks, Eagle Creek Park, which is almost 4,000 acres of land and has a large reservoir. And it's a wonderful place to go biking, hiking, paddleboarding, canoeing, or kayaking, or sailing. We also have a very popular bike path called the Monon. This is a rails to trails type of bike path that is 18 miles long. We also are home to the 2 largest single-day sporting events in the world, the Indy 500 and the Brickyard 400. I'm sure you all know these involve cars going very fast in a big circle. And then we have lots of fantastic music venues, art, theater, dance, opera, etc., and a wide variety of outstanding eateries and craft breweries. And I think that's the end of our presentation. Do you want to add anything, Dr. Fuqua?
Well, we look forward to meeting you. On the list of videos, you'll find a bunch of other things that will help you explore our division, research opportunities, diabetes camp, and tours of the hospital. And we hope that looking through these will give you a nice flavor of both the facilities as well as the overall culture of our program. We look forward to meeting you and answering any questions that you may have.
Good luck during the interview process and enjoy it. It's really a lot of fun. Bye-bye.